her shores. Feeling that she gives me, leave me wanting more and more.
Today and good
No matter where I
afternoon.
go.
Thank you for joining us for today's COVID-19 press conference. At this time, I'd like to recognize the presence of the Honorable Lourdes A. Leon Guerrero, Magahagan Guahan, Governor of Guam, as well as the Honorable Joshua F. Tenorio, Segunda Magalahan Guam, Lieutenant Governor of Guam. We also have with us in person State Surgeon Dr. Mike Cruz, Public Health Director Art San Agustin, Public Health Officer Chima Mbakwem. Joining us virtually, we have Public Health Chief Medical Officer Dr. Felix Cabrera. Also joining us virtually, we have our CDC Regional Epidemiologist, Dr. Thane Hancock, and Territorial Epidemiologist, Dr. Ann Pabutsky, as well as Physician Advisory Group Chairman, Dr. Hoa Wen. At this time, I'd like to give the floor to Governor Leon Guerrero for her opening remarks.
Thank you very much, Crystal. Half a day. We've come a long way in our battle against this deadly COVID-19 virus. But the reality is, our fight is not over yet. As seen in the latest data provided by the Joint Information Center, more people are contracting COVID-19. On Tuesday, we identified 44 new cases out of 764 tests performed, and our CAR score today is 8.8. While we continue to see a steady increase in numbers and an increase in our CAR score, our hospital admissions remain manageable. Of the 9 people admitted to the hospital for COVID-19, only 1 is in the ICU care. This silver lining is possible because of the over 104,000 Guam residents who've been vaccinated to date. To each of you who has rolled up your sleeve and got your shots, I thank you for doing your part to protect yourself, protect the ones you love, and of course, protect our community. Today, I must report that in line with the recent increase in positive cases, we now have evidence that the Delta variant is here. This morning, Public Health Director Art San Agustin informed me that of the 21 samples recently sent to CDC for sequencing, 5 samples came back with the Delta variant. Of these 5 samples, 4 had no known travel. This tells us that the Delta variant has spread within the community. The danger of the Delta variant is that it's more contagious, especially among those that are not vaccinated. For this reason, I continue to urge everyone who is eligible to receive the vaccine to get their shot today. Last week, I mandated that all GovGuam employees get vaccinated. Earlier today, I welcomed the news that the judiciary of Guam has followed suit and will also mandate their employees to get their COVID-19 shots. Now, I look to our sister branch, the Guam legislature, to do the same. What I am not here today to announce the reinstatement of restrictions, I am very concerned that we are headed in the same direction we were last August. Should our situation escalate, specifically with COVID-19 hospital admissions and the number of people requiring ICU level care, I will reinstate restrictions. For the time being, I urge everyone to continue vigilance with mask wearing. If you are not actively eating, drinking, or engaging in physical activity, wear your mask. In line with this, I have asked Public Health and GPD to continue enforcing the mask mandate and to issue citations to those who fail to comply. I also strongly encourage businesses and those hosting events to require vaccinations. This sends a strong message to patrons and attendees that we want to stay safe. Protect yourself, protect the ones you love, and protect our community. I would now like to turn over the mic to Public Health Director Art San Augustine.
Thank you very much, Governor. Good afternoon, Governor, Lieutenant Governor, our Physician Advisory Group Chairman, our Surgeon Cell, Dr. Mike Cruz, and members of the Public Health and Social Services team. Good afternoon, everyone who's listening today. We are now about 18 months into the COVID-19 pandemic. We have faced many challenges, but we have also overcome many adversities. Now we are at a very unique juncture of this unprecedented journey. I, along with the Governor Lou Leon Guerrero, Lieutenant Governor Josh Tenorio, we are joined by a team of experts, our Chief Public Health Officer, Chima Mbakwen, our Chief Medical Officer, Dr. Felix Cabrera, our Territorial Epidemiologist, Dr. Ann Pobitsky, our CDC epidemiologist, our regional epidemiologist, Dr. Thane Hancock, who will be here today to give us an overview of our current situation. Governor, we fully support, on behalf of Public Health and Social Services and for the community, we fully support your message this afternoon. We support maintaining our current sense of normalcy. But we also recognize the possibility of restrictions being reinstated to some varying degree as we are faced with increasing positive cases. And while we are seeing an uptick in cases, and although as the governor has just reported, there are 5 cases of the Delta variant in Guam, in any life and death struggle, we are confronted by both good and bad days. We know our enemy is not easily defeated, but it can be deterred. And we are in a very good position to defeat this enemy. We are in a better place than we were the same time last year. We have reached over 80% full vaccination of our adult population, and that number continues to grow. The Department of Public Health and Social Services has a robust contact tracing and case investigation team. Our quarantine and isolation procedures have proven effective, and our mask mandates, social distancing guidelines, and other requirements have been positive tools for all of us to return to pre-pandemic normalcy. I would like to remind the community of all the tools at your disposal to protect you at all times against COVID-19. First, if you haven't already, as the governor has also called for all of us to do, please get vaccinated. We all agree that public health measures and vaccine work against COVID-19 and the Delta variant. We know our vaccines are safe and effective against severe disease, hospitalization, and death. Public health continues to promote the layered approach to prevent the transmission of the COVID-19 virus. By following public health recommendations, we can prevent ourselves and others from being exposed to the virus. As a community, we have to continue to drive COVID-19 transmission down by any means necessary. I would also like to remind the community about the basic hygiene measures: washing our hands, washing your hands, watching your distance, and wearing your mask. With all these mitigation measures, getting vaccinated, staying at home if you are sick, wearing your mask, social distancing, washing your hands, our island is in the best position to bring down the number of positive cases, to cut out the chains of transmission, to protect the most vulnerable among us, and save lives. Thank you. And at this time, I'll hand over the mic to our Chief Public Health Officer, Chima Mbakwen. Chima.
Thank you. Hello. Good afternoon. Good afternoon. I'm going to stand on the existing protocols. Today, I'm going to speak about the clusters that we've identified through case investigations in our community. What has happened in the past few weeks, starting from the 23rd of July, we've identified 322 positive cases of COVID-19. Out of these 322 cases, 227 of them are local cases and 95 are linked to the DOD. Out of this, we've identified 643 contacts. But what has happened within this period is that we've been experiencing difficulty in getting information from individuals who were identified to be part of the clusters that I'm going to describe now. So on the 23rd of July, we identified a karaoke bar that had 5 cases that were linked to it. Within these 5 cases, we've made multiple attempts to obtain more case investigation information to reach attendees in this organization. We've actually met some stiff opposition from individuals who we reached out to get phone numbers and contacts of individuals. So up till now, there are some unknown attendees that are not quarantined from this establishment. There was also a wedding reception that happened on the 24th of July. From that, we recorded approximately 300 guests at that wedding. Out of this, 18 of them were positive. But the interesting thing about the 18 positives was that they are spread across 7 families. So out of these 18, 15 of them were also identified to have attended another occasion after the wedding. So in that same occasion, there were 21 positives that were identified. So 15 members from the wedding reception were also part of that barbecue that took place 2 days after. We've also identified some government establishments that are linked to these outbreaks. We've had on the news about the GFD cases that we have. We've actually been able to link one individual in 3 places that in 3 of the clusters. And then we also identified other members of the community who were part of the clusters that have also been in contact with other members of the community. So that's why public health is today conducting mass testing outside in the community every day at Sumbo, at Tizan. And the reason is that we've had difficulties in contacting individuals who are part of these clusters due to lack of information. So we're imploring people to please avail to the testing that is going on today until the end of the month at Tizan, so that we'll have an idea of what is going on in the community. Thank you. I would ask Dr. Ann Pobeski to continue the presentation. Thank you. And Dr. Tain. Dr. Tain Hancock from CDC.
Hi, thank you, Chima, and thank you everyone for giving me the opportunity to speak to Guam regarding our COVID-19 challenges and the arrival of Delta virus. Certainly, Guam has gone through a lot together responding to this pandemic and has done well changing response and adapting as the challenges that Guam has faced and everyone through this pandemic. They are dynamic as well and changing as well. And so now knowing that Delta variant is here on Guam, we certainly, it isn't something that's unexpected, but it's something that we still need to focus on and respond to. The increasing numbers in Guam re-emphasize how important vaccination is. It's more urgent than ever. The vaccines are safe, and they're effective at preventing the severe illness and death from COVID-19. They also do help reduce the spread of COVID in our community. And so just really want to reemphasize what's been said again. Delta variant makes the urgency of getting those that aren't vaccinated vaccinated even greater. If you look at our COVID-19 and Delta variant transmission in the United States and in the continental United States versus Guam, you'll see that one, we're finding that over 90% of infections, of COVID-19 infections, are now caused by the Delta variant. And transmission is highest in those states that have the lowest vaccination coverage rate. So what Guam has done to really help protect its community by getting vaccinated is really helping protect us. It's helping protect the hospitals. But if Guam can get all the rest of the folks that are eligible, anyone who is eligible, who's 12 and over and doesn't have a contraindication to get vaccinated, should get vaccinated. The other thing is exactly what Director San Augustine had mentioned as well, is wearing masks, especially CDC currently recommends wearing masks in any indoor public setting. And that aligns with what the governor's recommendations are. And then the other CDC recommendations, of course, are for schools as well, for K through 12, regardless of vaccination status. We recommend that people wear masks indoors. And a lot of that is due to having to adapt our response to the changing challenges that Delta virus provides to us. In looking at Guam data, I can pass that on to Dr. Pubitsky. But again, we're seeing that our hospitalizations are not what we were seeing previously, thanks to vaccination rates. And again, getting vaccinated is the most important thing that folks can do right now to help protect yourself and the larger Guam community against this Delta variant as we move forward. Thank you, Dr. Mbakwe, or Mr. Mbakwe.
He's getting promoted. To add to what Dr. Hancock was saying, we have seen an uptick in the number of tests and the positivity rate. So we're seeing more cases. A lot of those cases are in those, the biggest increase is in those under age 12 who are not eligible to be vaccinated. We've also seen an uptick in those between 18 and 39. And those are the people who are spreading it. We need to get those folks vaccinated. We've seen almost, we started to see an increase in military cases, and then we started to see a big uptick in local cases, some of whom were identified through contact tracing. That's all I have for now. Thank you.
I'd now like to recognize Dr. Mike Cruz, State Surgeon, for some remarks.
If I could just make a few comments. And although it appears that we are now 1 year, now another surge coming up, I think there's a couple of differences, right? And I think that the most important thing is that we have a weapon against this particular variant. We still have a weapon against the COVID-19 virus, and that's the vaccination. And although we're seeing a decrease in hospitalizations, my concern as the governor's chief medical advisor is that our healthcare system is still fragile. And a large part is because the hospitals, both hospitals on Guam, are seeing a significant op-tempo or census. This is in large part due to the fact that patients over the year of the pandemic have either deferred or delayed their care and now have a progression of their disease or a worsening of their disease. So even though we're seeing a decrease in the number of COVID cases going to the hospital, both hospitals are full because there's a lot of patients there with non-COVID diseases. So again, we're going to stress one more time that we need to get those that have been unvaccinated vaccinated, and as soon as possible. That's the best defense against the surge that we may have coming up. And I would encourage anyone who's not, and certainly those that have, get your friends, get your relatives to get their vaccinations if they have no reason not to be able to get it. Thank you.
Thank you, Dr. Cruz. I now like to give the microphone to Dr. Felix Cabrera.
Thank you, Crystal. Happy day, Guam, everyone watching. We have what I'm going to do here is just kind of give a summary of where we are right now, and then compare it and give perspective to where we were almost a year ago. So here you can see we have the data that goes from August 13 of 2020 last year up until today, this morning. As we recall that the COVID area risk score, or CAR score, is dependent on three main variables, which is test positivity rate, effective retransmission value, and also the daily new cases on a 7-day rolling average. And so that's why these others are shared here. So yes, our score now is 8.8. And we in the past, we at the highest point were 46.8, looking back retrospectively. And then during our August wave of last year, we hit a high of 26.8 at that time. So there was that initial wave, and then the wave that followed right after in October. And then this 46.8 was the cases that we have, particularly in the construction industry. And so that's just the perspective of where we are. Right now, there are a total of 8,769 cases that have been identified. There's currently 228 in active isolation. And over the past 28 days or the past 4 weeks, we've had 302 new cases. And then if you do that and break it down by community cases, meaning non-travel cases, and you do that per 100,000, you're looking at 154.2. And the reason why this number is important is because this is what the CDC helps use to determine our risk overall. And right now we're at level 3 out of 4. And so we still are stagnant at 143 deaths, which is we hope to not add to that. And then active hospitalizations, there are 9. Technically, there is 1 patient in ICU, but they are not ICU level status. They've been downgraded and just waiting a room on the ward. And then our daily tests have been pretty good at 481.6 on average. And then over 28 days, we've done over 6,600 tests. And so as you can see, as everything has been rising up, the test positivity rate at 5.3%, our effective retransmission value, which measures how quickly the virus is spreading, so to speak. It is the highest that we've ever had it, and it's at 2.38 right now. And then again, the daily new cases is now at 25. So what I'd like to do is just give an overview of the hospitalization since April 1st and the trends. So basically the solid purple line you're seeing is the 7-day average census for all the hospitals combined on island. And so again, right now we have 9 in the that are admitted into hospitals on Guam, 4 at GMH, sorry, I have that reversed here, 5 at GMH and then 4 at GRMC. And then how that relates to the CAR score, as you can see, we've had a low CAR score for a while, it's gone up. And then overall, we've even had higher average censuses with a lower CAR score than it is as high right now. And again, that can be attributed to vaccinations. And to make that even more clear is comparing last year and this year. And so just for everyone's orientation here, so the solid purple are the actual days, the census that day of COVID patients in on Guam hospitals. And then the solid purple line is the 7-day rolling average. Red is ICU patients. Yellow are vented patients, so patients on a ventilator or on life support. And then each black mark is an individual death. And then the gray shading is how many deaths over the past 14 days. And then brown, again, is the CAR score. So what I have done here, we're actually eerily close that August 11th today correlates pretty closely to August 21st of 2020. And the reason why I'm lining them up here is because the CAR score was very similar, 8.8 today versus 8.5 then. And when the CAR score was 8.5 in 2020, there was already 15 patients admitted, and there was an average of 13.1 admitted, 4 in the ICU, 2 were ventilated. And then on this day, on August 20, 2020, we had our 6th death, and then on the 21st, we had our 7th death. So two deaths in 2 days around that period. So that's where we have the 2 total for the 14-day sum. And so stark difference in what we're seeing here. So does this mean that that we can that the CAR score is no longer useful in determining what metric we really care about, which is hospitalizations and death? The answer right now is that there is a clear dissociation, but we don't know how big that dissociation is, and that it could very well, if it gets high enough, start correlating with increased hospitalizations. So we'll keep a close eye on that. And so one of the analogies I made earlier today was that the vaccines are like us having concrete houses and living in a typhoon belt. But the car score is still the weather outside, and we still need to know the weather. We need to still be protected and need to do what we can to protect ourselves overall. And there's nothing better than getting vaccinated, and that's what we see here. The last bit, I wanted to just give an update. So since 2021, since the beginning of this year, we've had total on island 134 patients admitted that tested COVID positive, and basically over 90% of them were unvaccinated. And so that's a very clear statement saying that if you are vaccinated, you are much less likely to require hospitalization or die or have serious illness. So there is proof in the numbers that we're seeing locally, so and it matches up similar to national and international data. And so that's the end of my slides. Thank you.
Thank you, Dr. Cabrera. I'd now like to welcome our panelists who are joining us virtually to turn on their cameras, as this will be the time in our press conference where we take questions from members of our media. Up first, I have Heidi from the Guam Daily Post. Heidi, you can ask your question.
Hi, good afternoon. So it seems that as of today, we still have more than 31,496 vaccine eligible individuals who have not been fully vaccinated. What's the likelihood that we can at least get 50% of this number to get vaccinated? And nationwide, what's the statistics on the number of people unvaccinated, or the percentage of the population that is really hard to get to?
Heidi, with regard to your question, I don't know if Dr. Thane, Dr. Politsky, or Dr. Felix would like to add on, but what I can share with you is that we don't have the number of unvaccinated on our population. But what I can share with you is that in terms of the vaccine numbers as of yesterday, we have 104,797 individuals that are fully vaccinated. And off that population, the 18 and older eligible is 97,051, and they make up 93% of those that have been fully inoculated. The population 12 to 17 make up 7% of that number, or 7,746. And so that's the number we have. And your question is of those that are not vaccinated. Is that correct?
Yes.
Yes. So we have 163,322. So we have 63,525 people based on the 104,797 to Guam's population of 168,322. We have 63,525 individuals that are within our population, but that's the general population, Heidi. So, what we need is 104,797 to hit 80% of the general population. At that point, we need 29,861 individuals to be fully inoculated as of yesterday. And that's the data as of the 10th of August. And so we'll get more vaccine data later at the end of the day, and then these numbers will be updated accordingly. I don't know if Dr. Felix or Dr. Thane or
I'll go ahead.
on the unvaccinated.
Yeah, I'll just go ahead and add one very important data point there, in that one is that for our most vulnerable population, age-wise 60 years and older, we're doing great in that 88% of them have been fully vaccinated. 92.4% of them have had at least one shot. But overall, what that means is that there's just over 3,000 of those that are 60 and over that are not fully vaccinated on Guam. And so, again, they are the most vulnerable for potential hospitalizations or death. And so, these are the group that we really want and we encourage to get out and get vaccinated. And so, this is the potential complications, especially with the Delta variant, is even higher and more concerning. So, so that's really also who we want to still encourage to come out.
Heidi, do you have a follow-up question?
Yes, can you tell us more about the Delta cases that we have here?
Heidi, what exactly do you want to know?
So these samples that were sent to CDC, when were they sent? And when do you think those samples were taken? And do we know the people who had those?
These samples were sent between July 2nd and July 6th. And these individuals were identified as local community members, and one was travel related. So four travel related and four non-travel related and one travel related case. But the team is actually looking back retrospectively to understand more about the individuals and where they've been and what else we can know about these cases.
What I think is to add to that as well is that understanding that those samples are from more than a month ago, and that's before we've had this increase in cases. And given that in the United States, more than 93% of all new cases identified and sequenced are Delta variants, that I think it's very reasonable to assume that vast majority of our new cases here on Guam are Delta cases.
Thank you, Heidi. Next, we have Nestor Lecanto, KUAM.
Thanks, Crystal. So just to be clear, the Delta variant has actually been here for at least 2 weeks. Is that what you're saying?
More than 2 weeks.
Yeah, it's been there for more than over a month.
Over a month. Okay. I was wondering, how about this virus exposure alert system? Is it being employed and is it not working? How are we not able to have traced the exposure? Chima, you mentioned the fact that there was 300 guests at a wedding reception. There was a barbecue. There's these GFD clusters, this karaoke bar. Isn't that alert system designed to identify people who have been exposed?
The system in place is speaking to the index case, who is supposed to be the person who tests positive. That is the only person you rely on to give you the names and places they've been to. If you can't get that information from that individual, then it becomes impossible to investigate the case.
Yeah, because it seems like it's not working.
It is working, is the individual, not the department. We have trained investigators who ask the right questions, but when people refuse to give you information that you need, then it becomes impossible. But what public health has done as a fallback is what you're seeing today. When we started seeing the increase in cases, the department decided to increase our testing capacity to capture everyone who might have been exposed. And if you look at the number of individuals that we've been able to identify as close contacts, we have more than 600 people that are identified. But if you look at our testing in the past 2 days, we've exceeded that number. And we hope that more members of the community, when they look at what is happening now, they can avail themselves to testing. So we're encouraging people who feel sick, who feel that they've been in places where they are not supposed to be at, to please go out and get tested. Thank you.
All right, but would you agree it's been largely ineffective?
What was the question again? The follow-up.
Is more of a comment, Chima. I have a question for the governor too. So, Governor, what would be the first restrictions that you would impose should the infections continue to rise?
Yeah. The first restriction that we probably would enforce would be social gathering. We probably would decrease the numbers in social gathering, Nestor. And then if we continue on, we would probably look at occupancies in restaurants and bars. And if you follow Chima in terms of clusters, most of these positive cases did come from social events. And social events, meaning big weddings, barbecues, also from the bars. And, those are areas that have the risk of transmission, especially if you're not wearing your mask. So in those areas, it's very important that our people continue wearing the mask, whether indoor or outdoors. That's our mandate, is to continue wearing the mask indoors and outdoors. So that would be the restrictions that we would impose. And then, of course, we'll look at should the need to have harsher restrictions need to be done, we will certainly do that. But I am very hopeful that we will not be going to that stage, because as more people get vaccinated, we are protected more. The severity of the illness is less, although you can still get infected. But as you know, this Delta variant, Nestor, is very infectious and very contagious. So those are things that we are looking at. But we are also recommending, and public health is going to move that forward, to ask people in these establishments and social events to require proof of vaccination to be part of the event. That's something that we will be messaging out to the hotels and restaurants through the Hotel and Restaurants Association, and to recommend and suggest and highly suggest that they impose that kind of requirement in their events.
Thank you, Nestor. We'll come back for a second round for you. Maureen Maritita, Mariana's Business Journal.
Yes, buenas, everybody. I wanted to go back to Nestor's point about the alert system.
Yeah.
So that doesn't depend on contact tracing from public health, right? It's a system that operates outside that. So basically what you're saying is that of those 300 guests at the wedding, 18 of whom tested positive in seven families, not one of those people got an alert notice, right? That's what we're saying.
So in response to your question, and I missed it with Lester, the COVID alert is actually supposed to alert the individuals who has been exposed to someone who is positive, but it's dependent on the individual who is positive registering on the app and also activating the app so that people who were exposed to him would also be identified. So the system is out. We encourage people, and we continuously encourage people to register on Sarah Alert, and also be able to use it when they turn positive, to alert whoever is amongst them or whoever is close to them. So the system works, but it's dependent on the individual who downloads the system and actually activates the system. But as a fallback, public health is still using the traditional methods of case investigation, where the individuals do not comply to this recommendation.
So the system works, but people aren't using it, is basically what you're saying. You have no evidence that people are using the SARA alert, right? Is that?
Yes.
Okay.
COVID alert,
right.
not
Sorry
SARA
to be
alert.
so precise, but I'm just trying to understand it too.
Yes, and the governor has actually and has always, even in the guidances, she's encouraged the community members to register and activate the COVID alert. And this is the right time for people to understand that COVID alert works, and is important for us as a community to trace people who have been exposed, or even alert them that they've been exposed so that they can go out and get tested.
Okay, thank you.
Okay.
I also have a question on the citations. So, Governor, you talked about the citations that public health and GPD would be enforcing. So would that go through the court system? And if it does, how do we know it will be enforced? Because we have a problem with enforcing traffic violations, right? So are we going to be able to enforce this, or will it, go on the
Yeah.
to-do list?
So, Maureen, we have in our rules and regulations the authority to cite violators of the mandate, anywhere from not wearing masks to even public, even restaurants and establishments for not adhering to their protocol. And so they have the authority to do the citation, just like a traffic ticket, and then they go through the traffic court for the enforcement of those citations. So they will be fined.
Thank you, Maureen.
All
Maureen
right, thank
Chargaloff,
you.
PNC.
Hello, everyone. My question is that it's been said more than once that a bump in the car score was expected after restrictions were lifted. Is this current rise in the car score, is this within the range of what was expected? And if not, what was expected?
Do you want to? So we did expect, we didn't really talk about the range, but we did say that it would cause increase in positive cases. We're tracking it very closely, but more importantly, we're tracking it together with the hospital admissions, and hospital admissions is still at a level that's manageable for us. We're not only just tracking hospital admissions, but we're also tracking the severity of the illness, the level of care that's required as a result of their admissions. So we did not have we think it's going to rise 10%, 20%, 30%, but we did expect a rise. And, the double digits, I think, is concerning. But like I said, we are also closely monitoring the status of our hospital admissions.
Okay, and given the car score and hospitalizations, I just wanted to be clear that I guess this is more a question for Dr. Cabrera, that even though the car score is similar to the car score right now is similar to the car score this time last year, but the situation overall is better. Is that correct?
That is correct. In terms of not just hospital numbers, but of course that the fact that there is nobody in that is a critical care status or on life support with COVID. So that's what makes it really reassuring. So it's a pretty good mirror in terms of the rate of rise in terms of the number of cases, our test positivity rates, and thus really the car score matching up is a really good historical part to compare to. So knowing what a car score of 8.5 translates to last year in terms of hospitalizations, and the fact that we're at 8.8 and we see nothing similar to that is reassuring. And we hope that trend continues. So it just remains to be seen. Last year, I'll share my slides with the rest of the media, but I purposely put on the rest of the for August of last year in terms of where the trends went up with the hospitalizations. By the end of August 31st, the car score was at 25, or just about 25, and hospitalizations were already over 40 persons admitted in the hospital. And that again was the 31st of August of 2020.
And is that disassociation? Could you go a little more into that disassociation again between hospitalizations and the car score? Is that because was the car score accounting for the type of hospitalizations as far as ICU, intubated, that kind of thing, or is it just the number by itself?
Yeah, so the car score does not include hospitalizations. We look at hospitalizations by itself, and then so the car score is a different value. So you look at both at the same time, and the correlation of that. So you're not seeing as much of a correlation as was what we did see last year. So in other words, our score may be doing this, hospitalizations are not necessarily going up as steep as the following the CAR score as it did last year.
All right, that's
Thank
all
you,
my
Wayne.
questions.
Joe Titano, Pacific Daily News.
Thanks, Crystal. Hello, can you hear me? Good afternoon, everybody. One question that stood out, looking at the number of cases that we've had in the last 28 days, I think something like 95 of those were military. And I'm just wondering, we haven't increased op tempo with the military lately. And can we just parse those numbers a little bit? Is that everybody who's a resident on Guam who's stationed here, or is that people who are coming through? Can I get a little more background on that? And how exactly is that affecting our CAR score? Where would we be if we weren't looking at those numbers? Like how many people in the community does that relate to?
Okay, in response to your question, the number that you see from DOD are those that are tested on a DOD facility. So the breakdown you're asking for is relative to what they give to us. They just give us the numbers of individuals who tested on base, and we count them as DOD members. But what they also do is they give us information about their contacts who are not on base, and Department of Public Health and Social Services will follow up with those contacts. So it's a mixture of us working with them.
Right, and one thing to follow up on the Delta variant, I know it's been here for 1 month and our CAR score, our numbers have been jumping. Is it too early to say whether there's a correlation? Is this what's causing the spike in cases? Are we gonna have to wait for those numbers to run back?
So Joe, I think and Chima and Art can follow up also. The rise in the positive cases, I think, is also related to not just to the variant, but also related to the fact that we have lifted restrictions. And as a result of lifting those restrictions, we see now some of the effects in the way of positive cases. So social gatherings, I think, is one of the most significant situations that have led to the high or the increase in the positive cases. And not just the amount of or the increase of people in the social events, but the fact that they're not using their mask. For example, I have been told that there has been events, social gathering events, and they've observed that in those social gathering events, people were not wearing their masks. So I think part of this increase in positive cases, Joe, is lifting the restrictions, but even more so, we are seeing complacency in our people, especially wearing of the mask. So again, what we can do to help mitigate those risks is to be very vigilant about wearing masks and watching your distance and washing your hands. We cannot be complacent in the basic mitigation efforts. And of course, most importantly is to get vaccinated. And we've seen evidence that vaccination does perform well and does protect our people.
Thank you, Joe. Joyce McClure, Pacific Island Times.
Yes, hello, thank you. My question is outside of the immediate community in a sense, and I'm wondering if you've thought about the impact of the V&V program and also the fact that more tourists are now beginning to come back to Guam. Where does that set up in all of this situation?
In response to your question, the restrictions for travel were lifted, but the caveat to it is that for you to come to the island, you have to be fully vaccinated, or you come in with a negative PCR, a negative test for COVID within 72 hours. And looking at that, and also following the public health recommendations of wearing your mask and continuously washing your hands and keeping your distance where applicable, you will understand that the transmission cannot be attributed to just one particular section of people. Like when we mentioned the military cases, we mentioned the local cases.
Oh.
Okay. When we mentioned those cases, it is clear that there's an ongoing transmission in the community. And as the team that is working on these cases, while we try to identify these cases as quickly as we can, the data you're asking for does not in any way show that there's anyone who has been part of the AV and V travelers who has been infected with COVID.
Okay, thank you very much.
Joyce, can I just add quickly that we are also tracking the Airbnb. We're getting the numbers of Airbnb people that are coming in to be vaccinated. And so far, like Chima said, we've vaccinated over 1,100 individuals. And out of that, one was positive, recognized or tested positive. And if you also, we're also tracking cases that are positive to see if they were through contact tracing or through traveling. And we don't see very many cases positive as a result of traveling.
Okay, good. Okay, thank you very much.
Thank you, Joyce. Tony Lamarana, K57.
Good afternoon, Governor. You know, most of the cases, as stated by the panel, were as a result of social gathering, and we're also seeing an uptick in those 12 and under. Well, tomorrow, the largest social gathering is going to happen with the opening of schools. Do we see any possible restrictions with schools opening tomorrow?
Tony, the schools have been given their public health guidance and protocol to help protect, of course, our children. And in my discussions with Superintendent John Fernandez, he is moving forward with the opening of the school, and they are going to adhere very strictly to the protocols that has been agreed upon and also guided by public health. So we will continue with that, and we will track it and monitor it very closely.
Okay.
I just also want to say that I was listening to a pediatrician, and a pediatrician was asked, how can we protect those that are not eligible to be vaccinated? And the best way to protect those people or in children that are not eligible to be vaccinated is to surround them with people that are vaccinated and to be in environments where people are vaccinated. So the Department of Education is having a massive vaccination campaign this Saturday, and they are vaccinating their employees, their staff, their teachers, and those that would be around those individuals that are not vaccinated.
Now, Governor, I know you put it. You're requiring that the line agencies be vaccinated or face weekly testing, and the judiciary has followed suit. A question was asked: who pays for the weekly testing if they opt not to get vaccinated?
The weekly testing is being provided free of charge by public health.
Okay. And also, again, tourism. I mean, we're starting to see some visitor arrivals. Do we see any changes and restrictions in the tourism industry?
The only changes so far that we've had, of course, is that they can, if they are vaccinated, they can go and not be quarantined. And if they come with a negative PCR within 72 hours, is that they do not require to be quarantined.
Okay, so same protocols still apply.
Yeah.
Thank you,
Yes.
Tony. We'll come
Okay.
around for a second round. Heidi from the Guam Daily Post, do you have any follow-ups?
Yes, thank you. So the first social gathering that Chima mentioned happened on July 23rd. So it's like 19 days ago. Does it usually take this long to announce the, the source of a cluster cases? And do we still not have any capability to identify the variants?
Okay, for the cluster cases, these cases are first of all individual cases that are reported, and then the case investigators move ahead to place a link between cases. So it's not a one-time decision that is made on who is part of a cluster. If you look at how we lay out the clusters, you're seeing that there are some individuals who were identified in two places at the same time. But for us to get that information, we first of all need to identify those cases, identify their contacts, make sure that they are all tested and quarantined or were isolated and quarantined. And then after that, then we start doing the epi-link. So this is the behind the scene work to link up all the cases. Because most of the time, you're seeing people who we don't know where the infection took place. You might test an individual who comes in, and then during interview, they will mention to you that they were somewhere else, and then the investigator is also investigating another case in that same environment. Then that is where the epi-link comes in. And when we're able to link these cases, then we're able to announce the clusters. So identifying the clusters actually takes a little more time than identifying the close contacts. And for the sequencing, we still rely on CDC for the genome sequencing. And you should also remember that the same CDC genome sequencing is used by all the states in continental US. So we're part of that sequencing that every other person avails to. So we still don't have that capacity now. And we'll continue to use CDC sequencing until we're able to do that locally.
Thank you. My second question, what's the GovGuam vaccination rate right now? And Governor, do you have any message to the legislature which has not mandated vaccination yet?
My message to the legislature is be a role model and go get vaccinated.
The vaccination rate for the government of Guam?
Heidi, with regard to the vaccination rate, this is data as of August 10th, also yesterday. When we have fully vaccinated, the 5,238 employees, we got 4,414 that are fully vaccinated. And so we're at 84%. And we also would like to report out that we've got 12 GovGuam agencies, our line agencies of 48. 12 of them at 100%, they're fully vaccinated. We have 11 at 90 to 99%, and I have a breakdown of that as well. But the two key parts is that we got 23 agencies that are 90% or higher already. And so that's of our 48 line agencies. And we're also compiling data for the autonomous agencies, but I don't have a complete listing of that at this time. I do have the line agencies. And so we range 12 again are at 100%. So that's really encouraging. And we shared that also with the governor and lieutenant governor during our meeting yesterday. Thank you.
Thank you, Heidi. Nestor Lecanto, any follow-ups?
Yes, thanks, Chris. This is for Dr. Hancock of the CDC. Dr. Hancock, does the CDC have any recommendations or an action plan for containing the Delta variant in relatively small communities such as Guam? Does it have any experience back in the States on what are the best things to do? What are the best options?
Yeah, thanks, Nestor. And certainly, as we've learned through this pandemic, that Guam is unique and that a lot of the responses and actions that Guam can take because of being an island and being a small community, can certainly change have different results than what happens in the US. Looking at the experience of the Delta variant in the US, we don't have similar places of the size of Guam that have experienced Delta variant. But if you look at the wider US, again, the Delta variant just really reemphasizes how important getting vaccinated is. And so if Guam can really max out our vaccination coverage, being such a small population, tightly knit community, as Colonel Cruz mentioned, leveraging family members to really try to inform each and every person on Guam who's not yet vaccinated that the Delta variant really changes that sort of risk-benefit calculation, where getting vaccinated is urgently more important to protect themselves and help protect Guam. So I think, for CDC, again, the emphasis is, hey, if you're not vaccinated, you're 12 and over without a contraindication, go and get vaccinated. And then, we mentioned about the mask use as well. But so, that's our experiences. I think, of course, we've all learned a lot from Guam's response and successes and ability to adapt and be nimble as COVID-19 changes its way that it tries to impact the island. I think we're at this, new situation where we thought, hey, 80% is going to be good for coverage rates. Delta says no. We gotta get more of our Guam community vaccinated.
Thank you. And the follow-up question, Governor, I know you've said for the time being, the schools will continue to open tomorrow. But if the situation worsens and it was determined that the schools would have to shut down, what would that look like? And knowing that how disruptive that would be to families, what is the plan, I guess, for returning students to online learning?
So the Department of Education continues to have, I think, a hybrid program where you could still do online. So there are going to be some online education and also face-to-face education. I know that Superintendent John Fernandez has said that, like I said earlier, is that they are going to monitor the situation very closely. They're going to adhere and initiate protocols as necessary and as situations occur. They are going to make sure that those that surround the students are vaccinated. And, as we do this every day, we continue to closely observe what's going on. And should the need required to shut down the schools again, to protect our people, of course, that is going to be, that will be established and implemented. But I am very confident that if we do our part, that we will not get to that stage.
Thank you, Nestor. Maureen Maritita?
I also have a question that the CDC might comment on. So in areas where the Delta variant took hold way before it did on Guam, they've also come out with the sort of statistics that we've been talking about today. So, more likely in unvaccinated people, more likely in younger people. So is there any wisdom to be taken from what's happening in Israel and the United Kingdom? Because initially they were thinking that the variant would peak, but that doesn't seem to have happened. Could you comment, Commander Hancock?
Sure. Yeah. Thank you, Maureen. I think for all of us in Guam and certainly for CDC, we're looking at data on the Delta variant, how it's performing in not only in the United States, but also what it's doing internationally, and especially in countries that have different types of vaccination rates as well as interventions. And really try to watch that closely, look at the data and be able to adapt recommendations and guidelines to meet those challenges. And as you mentioned, Israel's a good example of the Delta variant coming into a community that had fairly good vaccination coverage, but certainly causing a large number of infections. Fortunately, the number of hospitalizations and deaths, while they have gone up a little bit, have not been nearly as substantial as they experienced during their first waves. But we'll continue to monitor and learn, from what Israel is experiencing. There has been, based on those experiences, those are some of the reasons why CDC guidance, as you know, there's a lot of sort of concern that CDC guidance on masking actually had to go backwards, and that people who are vaccinated previously, CDC said did not need to wear masks. Now CDC recommends, hey, we need masks for any time you're indoors in public settings, as well as for a mask for everyone in schools K through 12. The other thing is really have looked at and realized that this new variant requires a higher level of coverage of vaccination in the community to really help keep down those severe illnesses, and especially if your hospital capacity is not at a point where it can handle a large surge. And so getting vaccinated, and as much as Guam can work together to get those last folks vaccinated, is really going to help protect us in the long run. That being said, as we mentioned, this is a changing situation. And so, responses and guidelines adapt and change. We'll see what will happen with future recommendations. But at this point, it's pretty clear that getting vaccinated, if you're unvaccinated, your risk of getting Delta variant is much, much higher, and your risk of getting severe Delta virus and being hospitalized is extremely high. And so that's why we'd really like Guam to be able to max out our vaccination coverage. Thank you.
Thank you, sir.
Thank you, Maureen. Wayne, PNC.
Hello. Are there any new updates on vaccinations for children under 12 as far as trials, expected timelines, that kind of thing?
I'm guessing that would be a question for me. There is an effort to look at vaccinations for children as well. There are studies are ongoing for those under 12. Data is not in yet, and unfortunately, I don't have any timelines or guesses of when that would happen, but do know that that is something that FDA, as well as in collaboration with the vaccine manufacturers, are looking at or are implementing studies to see how they perform in children and ensuring that they're also safe for those under 12 years old.
No further questions. Thank you.
Joe Titano, PDN.
A question for the governor. You mentioned that we're going to start encouraging maybe hotels to have to request vaccine proof for larger gatherings. Are we considering at this point maybe encouraging private businesses on island? There's some precedent for this in the States to go and have some sort of policy in place where they have their employees required to get vaccinated?
Actually, since we have publicized our mandate for GovGuam employees, I have gotten calls from private businesses that are going to be following suit. And of course, that's their own, business policy that they would have to establish. But I believe that they will start following suit.
Follow up to that, I know I spoke to Guam, the Hospitality and Restaurant Association, and I know that it's something that they are considering, at least encouraging. I mean, is there going to be any sort of a carrot and stick kind of thing to that policy? Or are we going to provide services to, hey, if you want to put in a policy, we'll assist you with the testing, anything like that for the private sector?
Of course, we will definitely help out the private sector in whatever way we can to get their policy implemented. If they want us to come to their place to test, we would. But we're also making more accessible vaccination sites and also more accessible testing hours. So.
And real quick, as far as, if I can just sneak one real quick, as far as exemptions, it's mentioned in the executive order. If a GovCom employee, the executive branch tries to get exempt, what exactly do they need?
I think public health will address that, but of course, exemptions, I think we're talking about medical and religious.
And so public health is going to just support what the governor just said, because that's exactly what we were going to respond to, is that the exemptions would be for those religious or medical health reasons.
All right, thank you.
Thank you, Joe. Joyce
I'm
McClure?
sorry. Just one other thing. It's actually a document that's filled out, and you provide the supporting documentation. It gets over through our immunization program, over to Chima, who's our Chief Public Health Officer, and then transmitted over to me for review and signature. And if everything's in order, then it's approved. Thank you.
Thank you, Joe. Joyce McClure?
Yes, thank you. I have one question for Thane, and that is there any news on the approval of the Pfizer vaccine? I know that that has been a major problem in some cases to get people vaccinated, that they're not comfortable before the vaccines have been fully approved by the FDA. So do you have any new news on that front?
Yeah, thanks, Joyce. Certainly some news that we're all anxious to hear a bit more of. I haven't heard any confirmed dates on potential approval of the vaccine. I think you may have seen in the news there are some folks that are speculating that it may be sooner than later. But right now I don't have specific dates. That being said, these vaccines have been given to over 166 million Americans, and in that have demonstrated really quite impressive safety records, and we continue to monitor these vaccines more closely than any other vaccines that have been rolled out. So they're looking to be, very safe and extremely effective, and so we're hopeful that that approval may occur sooner than later, but I don't have an exact date.
Okay, thank you. And one quick follow-up question. I recently moved here from Yap, and most of the news there comes from Facebook. And I'm wondering, I'm sure that a lot of it comes from Facebook here as well throughout the communities. And I'm wondering how you are overcoming some of the negativity and the conspiracy theories and the hoaxes and such that are still ruminating out there.
So for us, what we do is we have created an education team that goes out into the community to give the community, really true information, vetted information, accurate information. And for us, in terms of social media, we use the social media to send out messages that are correct information, and in hopes that maybe the misleading information can be then diminished or neutralized.
For us at Public Health, we're using the community leaders that we work directly with. We're using our staff. We're using the social media. We're looking at also using we're also looking at having town hall meetings to address this misinformation. But what we want to put out here is that misinformation actually kills, because the misinformation about the vaccines can only gain traction if people out there giving false information are not well informed about the survival, so for the reduced number of hospitalization, like Dr. Cabrera presented today about the low rate of hospitalization compared to what we have before. So at Public Health, we are actually looking forward to continuing our messaging, and then we are going to have a town hall meeting very soon to address this situation. So we are using every available opportunity we have to address vaccine hesitancy. Thank you.
Thank you, Joyce. And thank you to all our media partners who are helping us spread verified information. And last but not least, Tony Lamarana.
I'm sorry. Art said that 21 samples were taken to determine for Delta. 5 came back positive. That's 24% of those samples taken, which is basically 1 in 4. Is there any attempt to possibly increase that sampling?
Yeah, we're not very shy with the mic this afternoon. Actually, yes, the sample, there is a threshold that needs to be achieved in the sample. And once that threshold is met, those samples are sent. And the batch of samples that are sent, we can never really, as you know, actually tell you what the people say, well, don't you know the variant? We don't. Actually, that's why they're being sent. So they would then be sequenced. Once the sequence report comes out, that's when we'll know if they're an alpha or the Delta variant.
Okay, so you've tested 21, 5 came back positive. That's 24%. That's pretty high. Are you looking in the future to have more samples tested for the Delta variant?
To answer your question, the samples that came back also had other variants of concern, which we've had on the island, which is the UK variant, which has been predominant on the island. So the Delta variant was just discovered with this last result that we got from the sequencing. So and we continuously send more. We actually send this bi-weekly because Guam is a member of the network that sends the Guam lab is part of the network that send results for sequencing every 2 weeks. And like the director mentioned, the result has to meet a certain threshold for us to be able to send it. So it's just not sending every result. There's a criteria for the results that are being sent. So all the results that are sent from Guam meet the criteria, and then we send them, and then they are sequenced and the results sent back to us.
Okay.
But what we're discussing today is these results come back after the cases have been detected. So what we're discussing today is moving forward, what interventions do we have in place to mitigate transmission? What are we going to do to stop it? So if we are going to rely on the sequence results only to know what is going on in our community, then we're going to be doing that too late. So what we're saying is, let us stop the transmission today. Let us get vaccinated today so that tomorrow we do not have to send more samples for sequencing because we won't have cases that we have to send out. Thank you.
Okay. Now the line agencies, the governor instituted the protocol for either get tested or get vaccinated or to get tested. Are the autonomous agencies, Governor, also going to follow suit?
I have been talking to them, and yes, they will. Actually, Port Authority has already been doing it before we even mandate it. The airport only has, I think they said like 13 more to be vaccinated, and GPA and GWA are going to also. I spoke to John Beneventi, and he said that I guess CCU is meeting, and so they are going to also follow suit.
Okay. Thank you, Governor.
Thank you, Tony. Dr. Cabrera, I believe you had your hand up.
Oh, what I just want to just clarify, and so again, the samples that were sequenced were from early July, late June, and about a quarter of them coming back positive for the Delta variant is similar to how the cases were stateside. And then a few weeks later after that, it became over 50% of the new cases. A couple weeks after that, it was over 80%. And then more recently, it's about over 93% of all new cases in the country are the Delta variant. So, given that where we are, as I said earlier, that it's reasonable to deduce that vast majority of our cases today are from the Delta variant. And so we have to act accordingly and set our expectations accordingly. And so which makes the whole purpose of this whole press conference today is that the vaccines are our key component in combating the Delta variant, which is very much what we are challenged with today.
Thank you, Dr. Cabrera. And with that concludes our question round for today's press conference. Thank you, everyone, for joining us. Please be safe.